Okay, so it's 2 o'clock. I think we'll start. So thanks everybody for joining us today. We're thrilled to be able to welcome you to Responsible Disruption and our third Innovation Table Zoomcast. My name is James Gamage and I'm the Director of Innovation and the Social Impact Lab at the United Way of Calgary and area. We are excited to welcome our guests to the first of two discussions on the Indigenous perspective on the COVID-19 health crisis. But before we begin, I would just like to acknowledge that we are currently gathered on land adjacent to where the Bow River meets the Elbow River. The traditional Blackfoot name of this place is Mukinsis, which we now call the city of Calgary. This is traditional land of the Blackfoot Confederacy as well as Treaty 7 territory, which includes Kainai, Siksika, Piikani, Tsuut'ina, and the Stoney Nakoda nations. We would also like to recognize the Métis people and the Inuit people who have made their home here in Calgary. So before we begin today's session, a few housekeeping items to cover and our agenda for today. We're recording the session, so if you would like to share it with your colleagues or friends, we will email you a follow-up link in the next couple of days. The recording will also be available on our webpage and YouTube. Our next Innovation Table episode is next week on April the 29th between 2 and 3 p.m. Mountain. The session is entitled The Mental Health Impacts of the COVID-19 Healthcare Crisis and will be a table discussion with agencies who are dealing with these issues on a day-to-day basis, from the Centre for Newcomers, Woods Homes and the Silver Linings Foundation. Just an agenda for today. After this brief introduction, we'll go into a virtual talking circle during which the speakers will introduce themselves. We'll have a summary and then close. A little bit about the Social Impact Lab. So the Social Impact Lab is a partnership between J5 and the United Way of Calgary and area. In the lab, we address issues that matter to Calgarians, issues that affect all citizens, such as poverty, children and youth mental health, and community well-being. Our social ecosystems are being disrupted and there is demand for new ideas, solutions, products and services, and this demand for support continues to outpace the supply of funding and services. We in the Social Impact Lab are responding to this disruption by investing in innovation and creating strategic partnerships that support the social ecosystem and the sector to not only serve but solve social issues. In the Social Impact Lab, we have created a new platform called Responsible Disruption. Responsible disruption is about being aware that we don't want to create disruption for the sake of disruption. We want change to systems, models, and people to be fair, considered, and compelling so that it has the greatest impact on the places in which we live. We are now almost 5 weeks into the COVID-19 health crisis and lockdown that has had a huge impact on everyone in Alberta and across the world. Literally overnight, everything that we took for granted has changed, from the way that we buy our groceries to the way that we live our family lives. And longer term, this will have a profound impact on the local, national and global systems in which we operate. The United Way Social Impact Lab wants to convene a series of discussions about our response to what is going on right now in the province and communities, businesses and in the social sector, and how we build recovery and resilience at an individual, local and national level. This week, we wanted to get the unique perspective of the Indigenous community on the current crisis. Our guests will introduce themselves as part of the talking circle, but we're honoured to welcome Dr. Lana Potts, Lee Maracle, Danica Littlechild, Shane Gauthier, and Dr. James Makokis. Our moderator will be Daisy Giroux, who is a strategy lead here at the United Way of Calgary and area. So welcome to you all, and over to you, Daisy.
Okay, Tansé, bonjour. Hello, everyone. Welcome to this amazing opportunity to learn from our Indigenous knowledge keepers. I'm very honored to be part of this Zoomcast with all of you today and to be able to spend some time with our amazing speakers. My traditional name is Ahkakiohpapokaki, which translates to Driftpile woman, and I was gifted that name by our elder Reg Croshu of the Piikani Nation. I am from the Treaty 8 territory. of Driftpile First Nation, and I've been part of Treaty 7, a visitor of Treaty 7 for 8 years. And I'm, as James mentioned, I am the strategy lead for our Natoo'si Indigenous Healing and Wellbeing Initiative at United Way. Very honored to be facilitating this talking circle, and we really wanted to try to simulate as much of an authentic experience of a talking circle. So right from the beginning process that you all as participants would not have been part of is that we follow protocol of gifting of tobacco. So we did offer tobacco to all of our speakers. And so I want to take this opportunity to virtually again offer the tobacco to all of our speakers, and thank you so much for being part of this conversation with us. And the way that the talking circle is going to work is I will invite our speakers to introduce themselves as part of our round 1, and then go into questions for our round 2. And I will go in order of how I see them on my screen. So you may be seeing them in a different way, but I will be inviting them in the order that I see. And just to give you some context of our talking circle, what a talking circle is it's a parallel to a Western system of gathering, meetings, governance, sharing or validation, just to name a few. And the purpose of today will be to share the knowledge and to hear from our speakers. And when we are in a talking circle, we usually use a talking piece. So I do have a feather that I will be signaling to the person that is going to be inviting to speak next in our virtual talking circle. And I do want to take this opportunity to humbly thank our speakers and to offer my apologies that in traditional talking circles, I would have been able to shake your hand and give you hugs, and for people that are witnessing to see us all sitting in circles. So if you can visualize us all sitting in chairs in a circle, and that I'm facilitating this process, I just wanted to share that so that you can visualize that and try to have as much of a genuine experience as possible. We use a talking piece, as I mentioned, so I will be sharing that when I'm inviting the next person to speak. And then, as I mentioned, we're going to be doing 2 rounds. So this is a 2-part conversation. The first part will be round 1 and 2, because in our traditions, when we have a talking circle, it's usually done in 4 rounds. And I want to acknowledge that there are some tribes that do these processes differently, but we're just sharing the process that we were taught to do in 4 rounds. So as James mentioned, on April 29th, we'll be inviting our speakers to come back if they're available to be part of the 2 last rounds of our talking circle. So I guess we'll get started. One of the things that we usually start with our talking circle is we start in smudge. And so I wanted to offer the smudge to our speakers. And I also invite our participants as well, when the smudge is lit, if you wanted to just do the motions of smudging. And if this is new for you, smudging is a form of cleansing. It's a form of cleansing the environment, cleansing our energy, so that we're coming into something in a good way, and to parallel, much like a Western understanding of a gavel, bringing us together in a meeting and starting the meeting. So I wanted to offer this smudge. So I invite our speakers, if they can just do the motions of a smudge, or if you have your own smudge, you could do so now. And I invite our participants to do the same as well. And after that, we will get into our round 1. So I'm going to go into the order of how I see people on the screen, as I mentioned. So I am going to pass the feather on to Dr. James Makokis, who will introduce himself.
Tansin etitemte kagawa nawaga magandik James Makokis netsigasan egwa utinia unixkaponi Ahkakiohpapokaki tegwa mestigwaskik na basis nawihuin. Hi everybody, it's nice to see you. I'm James Makokis. I'm a family physician that works in Kinokamasik, or Kihiwan Cree Nation on Treaty 6 territory, and originally from the Satellite Cree Nation. So it's so nice to be with you all here today.
Thank you, James. And now I invite Lee Miracle to introduce herself.
I'm Siam Lee Miracle, OC, Officer of the Order of Canada, recipient of the Queen's Diamond Jubilee Medal. I have 2 doctorates, by the way, and a number of writing awards and teaching awards. So I like to be referred to, though, as Siam, which is what the Governor General refers to me as when I received the Office of the Order of Canada. I'm also an author, a healer, and a consultant.
Thank you, Siam. I would like to pass it on to Dr. Lana Potts to do her introduction.
Okay, everyone. Thank you for having me here today. It's nice to do something a little different than my usual clinical work. So I am I am from the Piikani Nation. My Blackfoot name is last to come in. It was given to me by the late Doris Many Guns. I'm many things to many people, and my main role that I'm always proud of is I'm a mom. I'm a mom of 2 beautiful children, Anadaki and Noden. I work as a family physician. I work as a medical director. I work in a school. I do many things, and I think while my passion ends up being just really trying to help my people, give back to my community, and it's the whole role of how I came into this role. So I've worked in Mohkinstsis now for about 9 years, just in different capacities. And I've never come across Daisy until now, but I think we run in similar circles. And I think it's really good that we're doing this and to be able to share. And I thank everyone for coming together, and thanks for inviting me.
Thank you, Dr. Lana Potts. I invite Danica Littlechild to introduce herself.
I'm really honored to be invited to this talking circle, and I want to honor Daisy for your leadership and for helping us through today's event, and to all the people who are sort of behind the scenes supporting us. I really thank all of you. And I want to thank everyone who's participating for joining us to think about some of the issues that we're going to be discussing. And I hope that what we share serves as a catalyst for further thought. So I'm from Natoo'si, from Urban Skin Cree Nation. That's where my late dad's from, and my mom is from Kihiwan, which is where Dr. Makukis is currently. My mom is a Dion from Kihiwan. And so I am an assistant professor. I actually just started my job on January 1st, 2020. And before that, I was a lawyer practicing in Alberta for almost a few decades. And so starting a new position at Carleton in January and then heading straight into a pandemic has been quite an adventure. And added to the mix is that I'm a mom of a very active 3-year-old named Pablo. So it's been a lot of fun. I also have really enjoyed in my law practice working with Indigenous peoples, working in Treaty 6 territory, but also in other Indigenous lands and territories across Turtle Island and internationally. So it's been a real privilege to work and serve Indigenous peoples, and now I'm in this new role of teaching, so it should be very exciting. Thank you.
Thank you. All right, and our final speaker, I'd like to invite Shane Gauthier to introduce himself.
Very much. I'm having technical difficulties because I live out in the country. So if I cut in and out, I apologize. Can you hear me? Can everybody hear me?
You're coming in and out, Shane.
Hear me?
Yeah, you're coming in and out a little bit, Shane.
Yeah, that's what I was saying. Okay, can I sign back in? I'll sign back in from a different area of the house.
For sure.
Okay, okay.
All right. So I'm not sure if James Gamage, if you have Shane's bio handy, is it possible to maybe read that on Shane's behalf? If not, then we can just wait until he
Sorry,
gets
I don't
on.
have it handy actually.
Okay.
But maybe he could freeze his video when he comes back on if he's still having problems, and then that might reduce the bandwidth.
Right. Okay. All right. Well, while we're waiting for Shane to come back on, I just want to welcome all of our speakers to be part of this talking circle and to share your knowledge. I'm just going to ask the speakers 2 questions, and they have the option to answer one of those 2 questions. And if there is time allotted, then they are invited to answer the second question or the other question. As mentioned, we are going to be having the last 2 rounds of our virtual talking circle in about a month's time. I believe April 29th is the date for our speakers to come back. And hopefully they will be able to join us again and share more of their knowledge on what's been happening with our pandemic, and in about a month's time. So I'm not sure if Shane is on, but so I would just share that Shane is the Executive Director or the CEO of the Aboriginal Friendship Centre here in Calgary, and has been truly instrumental in providing first response supports for our Indigenous community and for our Indigenous elders, along with other organizations that are going towards those efforts. And so Shane, I see that he is getting connected. I just want to acknowledge him for all of the tremendous work that him and his staff are doing at the Friendship Centre to help support our Indigenous people during this time. Shane, are you able to, if it might be easier for you to shut your camera off and just use the audio to introduce yourself? And then that might be easier.
Okay, I did move around to a better spot. So is it working okay now?
Yep, we could hear you
great.
now.
So thanks for the introduction, Daisy. I'm sure you did a great job. I'm from Northern Alberta, Métis, Cree Métis, and very honored to be here. And I'm just humbled, and I don't really like to talk too much about myself, but I grew up in poverty, and the only way out of poverty for me was education, and just very blessed and lucky to be here with everybody. And thank you very much for having me. So hi.
Thank you, Shane. All right, well, that completes our round 1 of our talking circle. So now we'll go into our round 2, and I'm really excited to hear what our speakers have to say on these 2 questions. So we did ask them 2 questions, and as I mentioned, they are asked to provide an answer to one of the 2 questions, and if there's time, they can answer both. And so the first question was, how has the Indigenous community been affected by the crisis of COVID-19? And the second question is, how is the Indigenous community using its practices and knowledge to respond to this crisis? So I will go in the same order of our first round. So I will pass the feather to James Makokis to start.
Thank you so much. So I'm going to answer the first question, how has the Indigenous community been affected by the crisis? And I'm just going to contextualize, so as a family physician with a background in public health, working in a rural Cree or Nehiyawa community in northeastern Alberta, personally, when this first started, I didn't think it was going to be as bad as it is, as I'm sure many of us did. And then quickly was alarmed by one of my Indigenous colleagues who works in the Northern Territory of Australia, who really encouraged me and many Indigenous physicians to take leadership roles in our nations and say, you know, how are you protecting your people? Because we're worried that in our area, this could possibly make us go extinct. And so when someone says something like that to you, it's very alarming. And our people have been through many different challenges in the past with virgin soil epidemics and pandemics. And it's important for us to remember that we're not immune to those things. And that in spite of having all of our amazing all of the amazing gifts that our people have of our medicines, our maskihia, our titigaona, our ceremonies, all of those things, we still need to be very careful and cautious with this pandemic. Because if we reflect on what happened with H1N1, for example, we know that our communities were 5 times more affected because of the social sicknesses of colonization. And so we're very fortunate in Kihiwin to have an emergency pandemic committee that we meet daily, twice a day, to discuss the needs of specific needs of our community, which are different from non-Indigenous people. And early on, we did our own modeling scenarios as to how this would affect the Kihiwin Cree Nation, and it was very alarming to us to know the effect on mortality and morbidity that it could have. And so we started planning early on, and one of the decisions that we made was to close the community. And so it's important for us to know and think from our treaty perspective of being a nation, that we need to also act and assert our sovereignty over things like this. And remember that especially in Treaty 6, we have the medicine chest bundle, which asserts our right to universal health care and to medicines and to access health services in a way that doesn't involve racism and things like that. In our planning, we knew that if our people became sick, and this is how it differs for Indigenous people, that based on the experience that our relatives have going to hospitals and urban centers, whether that's in Edmonton or a rural area, that there's a higher likelihood of racism and not being seen. So if people are presenting with symptoms of respiratory distress, oftentimes, they need to be triaged appropriately in an emergency room setting, and many times their vital signs aren't taken. So how can you assess someone properly if you don't know in what position they're in coming into the emergency room? And they're often sent home to their overcrowded house, where now that it's springtime, we're having to worry about how are we going to get the water truck into the home when people are staying at home and they need more water in their cistern. So it's a very different scenario on reserve. And I feel that we have had little direction from Health Canada, who has a fiduciary responsibility to protect and work with people on reserve specifically around this thing. And so we've been proactive in having to plan around this as a community. So, part of the thing in terms of closing the community is realizing that there's a road that goes through, that's a provincial highway that divides the community in half. And so, we're all familiar with the blockades of roads and things like that, and how that was very unsettling for Canadians. But we take the position that our health supersedes all economic interests. The health of our people is paramount, that we need to survive this, and that any case is too much. And so if we need to close a road that just happens to go through our reserve territory, then we will do that to protect the health and interests of the next generation of people. And so if that means, interfacing with the RCMP, and what our people have to remember is that we are sovereign nations, and especially in the time of pandemic, that we need to do our best to protect our people at all costs, because we are most at risk for the effects of this virus. So at the same time, I just want to close with, you know, it's been very triggering, I would say, for people to be closed into their community based on what's happened in the past with government policies. And so we're doing our best to focus on mental health interventions and positive aspects like learning Nahiawewin, the Cree language, that we can do virtually with people and elders in our community that can teach that. So thank you.
Thank you so much, James. I will pass the feather on to Lee.
Hi, for inviting me here. I want to say, first of all, that this is not the first pandemic we've endured. We did go through H1N1 and we did go through SARS, and it did affect us in much the same way that we're currently affected, which is that we cannot socialize in the way that we are culturally accustomed to. That is, our larger family gatherings had to stop. Secondly, we have begun just recently to realize that smudging isn't just a religious thing, that it's also a more effective antiseptic than anything Europe has. So my family's starting to use it that way, as opposed to just alcohol, which is not as thoroughgoing in our homes. We should be burning smudge inside our homes chronically and constantly. The third thing is that just as the last two sicknesses affected us because we didn't have water, many of us don't have good water. So that becomes a real burning issue, particularly since the Liberal government gave our water money, which was $7 billion, to the oil pipeline individuals. And this came from a government official that I was told this. And so that makes it clear to me that maybe they don't really want us to survive this pandemic. I'm very suspicious of it. Poor people and Blacks and Indigenous people have been affected adversarially all across the country and all across the United States, so that we have the majority of the illnesses that are going on and the majority of the deaths that are endured, particularly Blacks in America. And it's unnecessary deaths that we're enduring. So that's something I think we need to pay attention to and need to take more sovereignty over our health. And I like what our previous speaker had to say, but a village is not a nation. My nation goes from the Fraser Valley down into Washington, over into Kinshasa on southern Vancouver Island, and up the coast to Quebec territory. That's the size of my nation, almost the size of France. So we are concerned about that. We are concerned about how we connect with each other, how we coordinate with each other. And of course, the internet is a major, major source. I do know that not every community has access to internet, but internet capability is going to be critical if another pandemic comes around. And I would advise all First Nations communities to become internet capable, particularly in social media.
Thank you so much, Lee, for sharing. I will hand the feather on to Lana.
Thank you. It's interesting when this started, and I'll share with you a story. So I went to California at the end of February with my family on a trip. And when we came back, we were hearing things in the news, and it was prior to when I left, I talked with James, and James had said to me, we need to be prepared for this. And I was a bit naive. I was probably like the local, most people, just thinking, oh, it's just a flu. It's just, I see this all the time, it'll pass. And when we got back, there was an eerie feeling that kind of came over us in our house as we got sick. We got sick, and I thought, what does this mean that we're sick? Did we pick this up? Did we bring this back as we were in Los Angeles and we traveled? And I started to think around what does this mean for me and my community and the work I do? And looking at this historically, around the same time, I was doing a presentation on the historical perspective of tuberculosis. and germ warfare that was used in residential schools. I did a presentation at around the beginning of part of March. And the parallels of what happened with the tuberculosis outbreak and the smallpox outbreak and the Spanish flu outbreak just started flooding back to me when I started seeing this fear that was happening in community, the fear of what's going to happen to us. Are we going to be isolated? Are we going to be shut down? Are we going to be locked in our community? Are we going to be sent away and we're not going to go home? And this is happening. It is happening. And I think the reality is it's affecting people in a different ways. And I often speak from my heart. I see this as a doctor, but I see this as a community member, as a human being, that this is really hard on us. It's hard because it's triggering a past that we carry from our residential schools, our families, the loss of, when we weren't asked not to pray, but we were asked to pray in a different way. Because holding ceremony can actually harm people if there's large groups and if one person is sick and we pass it on within that ceremony. These were things that triggered people, and I started to reflect on this question when it was given to me is, what has this done to our communities? I think it's heightened our awareness of where we've come from. It's heightened our awareness of where we need to go, but also really started to look at what do we have and can we function as the so-called nations they expect us to function as without partnering with each other, without reaching out to each other to say we need help from community to community and to be able to do that freely. And I think there's a pushback that's happening for people not to want to isolate and not want to do this because we had this liberty and our freedom taken away from us for such a long time. And that struggle, I struggle with that as a doctor because I know where people are coming from. I believe in our ways and our protection, but at the same time, I always was told when we know better, we do better. And I think there's a role for both Western medicine and traditional medicine to help us through this. I see this really us starting to listen. I think one of the positive things through this is we're starting to listen. We're starting to listen to Na'a. We're starting to hear that she's sick. Our earth is sick. And this is a way of this kind of rebounding back to us to tell us that we need to listen. We need to be present with each other. We need to connect back with our medicine. We need to connect back with our ceremony, connect back with each other, start to appreciate those relationships with each other. I see a panic of, well, what's going to happen when we're sick? I can say this, that right now in community, we have no confirmed cases that I'm aware of. You know, I always have to say a time at 2:32, but this could change. So what happens when we get sick? And there's that, I feel it grumbling there, that where do we go? Will we have to leave? Will we come back? And yet, this is what's happening. What's happening is here today is something very positive. It's we're connecting, we're sharing story, we're realizing our strengths come from each other, and that it's through that we're going to get through this. And so I can't predict what's going to happen when we do get sick, but I want people to really be aware that we need to listen to each other. We need to follow our teachings of listening to our elders, listening to those with knowledge. And some of them do come from the Western world and they're speaking from a good place. And to really start to take stock of protecting ourselves. We use protect our spirit. That's what we say in our house. Protect your spirit, feed your spirit, and smudge. And through that, you know, we can continue on in a good way. So that's kind of where I'm at and what I'm dealing with day to day personally, but also with my family. Thank you.
Thank you so much. I'm going to pass the feather on to Danica.
Hi, Daisy. It's been so amazing listening to all the panelists so far, sharing such amazing information and ideas. And, you know, being in Ottawa, I have heard a lot of people talk about how coronavirus doesn't discriminate. But as a former rights advocate, I know that societies do. And so while everybody is sort of thinking about the way that we are dealing with the pandemic on a more global or national level or sort of macro level, I think the way that it's impacting Indigenous peoples has serve to just heighten inequalities, the inequalities that we already experience, and to potentially, you know, do significant harm to Indigenous peoples in terms of their lands and territories as well. And so what's interesting is that we are seeing a lot of advocacy coming from Indigenous peoples through different organizations or through their governments. And even at the level of the United Nations, there has been different statements released by the Indigenous mechanisms of the United Nations about how this is impacting Indigenous people. So I would encourage listeners to go and look up those statements because they are important to read. But all that to say that people are very much thinking quite deliberatively, and they're thinking really hard about how this pandemic is impacting Indigenous peoples, but also may impact Indigenous peoples. And without repeating a lot of the issues and ideas that have already been raised by the panel, I think sort of re-emphasizing that you know, some of the issues around food security that have become so prominent with the pandemic, those are only even more heightened for Indigenous peoples, whether they're in a reserve setting, a Métis settlement, a community setting, or in an urban setting. I think food security has become a really huge issue. And that is directly linked to issues around poverty and inequality as well. And so, you know, one of the challenges for especially those in remote communities is just how to make it through what promises to be quite a lengthy time in order to sort of get through how this virus, I guess, plays out. And I would leave it to my colleagues to describe that trajectory. But certainly drinking water is a huge issue in many First Nations reserves and Métis settlements and other communities. But we also know that just simply accessing basic services is a challenge for so many Indigenous peoples, whether they're urban or rural. And so I think we have seen some gestures by various governments who are made aware that these are crises for Indigenous peoples. But I think the gestures have been, for the most part, uneven and potentially inadequate in terms of what the actual experience on the ground is for Indigenous peoples. And I think part of it is, you know, amplified by the fact that we have such poor access at times to healthcare when there isn't a pandemic. And so this has only heightened, you know, scenarios like that. And we have people, you know, who are thinking of going back to community and potentially bringing the virus with them when they do that. I mean, I definitely had a fight or flight response to this pandemic. Having just moved to Ottawa, I wanted to immediately return home. And I was convinced by some amazing health practitioners that it would be more harmful for my community for me to run home with my son than it would be for us just to ride it out where we were and where we had moved. And so I had to sort of accept that and move on and try to manage as a single mom in an urban environment, sort of newly arrived. But my biggest concern around how the pandemic is impacting folks is with regards to ongoing environmental disruptions and developments and how those impact rights of Indigenous peoples. And recently the Canadian petroleum producers had written a memo to the federal government stating that they wanted the suspension of certain regulations, the suspension of development of policies around climate or environment, and essentially calling for what would amount to the suspension of the implementation of the rights of Indigenous peoples. And if this is something that they, as a powerful lobby, in Ottawa, and by the way, they asked also for a suspension of rules around lobbying. You know, if that's what they're sort of asking for, they're asking for a free pass, that the pandemic somehow gives them carte blanche to go ahead and continue the kinds of development that has been completely destructive towards the lifeways and the lands, territories, and waters of Indigenous peoples. It's really awful that these developments are considered essential services, and yet Indigenous peoples who were previously on the front lines of protesting this have to choose between protesting and potentially exposing themselves to the virus, or going home and being isolated and looking like they acquiesce to the development. So that's one of my major concerns moving forward. Thank you.
Thank you so much, Danica. And our last speaker, Shane Gauthier.
I'm going to repeat what everyone else has said, but I can offer my observations and my learnings. So when this pandemic hit, we're a helping agency for, you know, for Calgary's urban Indigenous peoples. And so when this pandemic hit, we, you know, as a CEO of the Friendship Center, I had to mobilize a team so that we could help. You know, there were 41,000 Indigenous peoples in Calgary. So we, instinctually, we need to help the most vulnerable people in Calgary, and most are Indigenous. And so already they're vulnerable, and this pandemic exacerbated the situation. So we had to act, and one of the things we had to do, one of the many things, is create partnerships, collaborate, coordinate. I needed to reach out to everybody, all the agencies, and also the funders and the city of Calgary, to mobilize to help the people who are already at risk. And this pandemic exacerbated the situation. So we had to act and look at the basic needs. How can we deliver hampers, the food hampers? How can we help, you know, the single parents, the elders? So we had to, it was just really multi-layered. We had to really look for the guidance and the wisdom from the elders. And we also had to look at the needs of the community members, where when we look, there's so many different facets to this. So when we were picking up hampers at the food bank, the food quality was not very good. And a lot of our people have diabetes and so on. So we went out and bought high protein foods, high quality foods. So we were able to give out 500 hampers to people. We had to be creative. I had to come from a place of yes. So when community members needed non-food hampers, diapers, baby formula, so we struck a partnership with Awaton immediately and supplied with, you know, baby formula, diapers, the stuff. So we like to tailor. We had rough sleepers, so we had hampers for homeless population, but rough sleepers who don't have access to, you know, microwave or can openers. So we had sandwiches and juice boxes and stuff. So we had, the first phase of it was really the response phase. Like, how can we come together as partners? Like we currently have over 23, 24 partners at the table. Thanks to the United Way, we have a task force meeting every 2 weeks now. We've got provincial partners, we've got city partners, we've got other agencies as partners. And how can we dovetail each other so we're not being redundant, so we're being efficient? And so we have to also acknowledge that there's a huge gap when you look at the financial assistance programs. Our people need money now, today. And so it's great to announce that all these billions and billions of dollars are there for folks, but do they have computers? Can they fill up the applications? So we have a full-time task force coordinator who takes calls. It's like a hotline, so people can call her and they can help. They can ask for referrals. They can ask for assistance, like if they need help with something, if they need help filling out an application for dollars, for supports. And we also have an elder. So we have an elder hotline where community, you know, another aspect of this that, you know, non-Indigenous folks maybe don't have to look at or address or impact it as much as when you look at the self-isolations and the social distancing, that works completely against what culturally, you know, we're taught, if that makes sense. You know, we need to be with each other. We have, you know, 10 family members in one room or 20 depending, and so we support each other. We need to have ceremony. And so when all those, the Quarantine Act, when the state of emergency was established, so all that was working against the culture, and we had to address mental health issues because of that. Like, we have to support people holistically. So we're looking at food security, we're looking at non-food hampers, and a part of the food hampers, as we call love packages, is items to help families or individuals address the isolation, the mental health, or the impact of self-isolating. Or so we try to be faceted in addressing the needs of the urban, because that's what we serve, the urban Indigenous peoples in Calgary. And as I said before, they were already, vulnerable, but this pandemic hit, and at the beginning, people really didn't know. So a lot of it was education and awareness, and we didn't know how long it was going to last. We didn't know, what the end, like what does it look like? So as information was coming in, my job, one of my jobs was to disseminate, to get the information out to our community, and to help them. And another thing is we had to be very creative. So we had somebody leaving the hospital, and this person, she didn't have clothing. So I said, well, you go out and buy clothing. We need to support the elders. We have somebody who cooks, cooks for the elders, stew and bannock, or like chicken and vegetables, because we're looking at healthy meals, and these are large meals, like for the elders. So I think what it's done is it's brought us together. I can see immediately we mobilized as a community in Calgary, and we came together, whether it be other agencies or Indigenous agencies or Indigenous serving agencies or funders or stakeholders. We came together, and I think that was sort of something that was really needed. And I think that it was very welcomed for the community. And we have, because of that, we were able to, our reach was much further, scope and scale. So we were able to deliver more food hampers or non-food hampers, or to assist more people to fill out the financial assistance program, or even to help people in other ways. We have to be creative, and even with the applications for funding. So my job is to fill out all the applications to secure dollars, and to help with this pandemic. And with the government processes, you wait. So you have to wait, but people need assistance and people need help now. So that's a struggle. That's a gap that I can, one of the learnings. But we mobilized immediately. We tried to do the best we could. And I have to give a lot of credit to the outreach team that I have. They saw a need, and they went out, and they were creative. They were problem solvers, and so that's my observation with the urban, with the urban Indigenous peoples.
Thank you, Shane. Thank you to all of our speakers for sharing your incredible knowledge and the landscape of your where you're working from, and both from an urban and a rural perspective. So I just wanted to take this time to put a pause on our talking circle for our next 2 rounds that we'll have upcoming in a month. And I do apologize. I know I mentioned April 29th, which is next week. I don't even know what day it is sometimes. So we will be bringing people back in a month. So I'm not sure exactly what date that's going to be, but thank you for the participant that pointed that out. So I just wanted to quickly kind of summarize, and I apologize to our speakers if I miss anything, or if I didn't share everything that you had talked about. But luckily this Zoomcast is being recorded, so we do have we can go back and watch and listen to our amazing speakers. So I want to thank all of you for sharing what you shared today, and I believe that yeah, we're all in this together, and we're all really feeling this and the impacts of it, and responding to it in very different ways, and being forced to be creative and forced to think of kind of leaving our comfort zone and creating this responsible disruption that to address, you know, what's going on in our communities and globally. So I just wanted to quickly go over just an overview. And I apologize because I was taking notes, so I am going to be looking down at my sheets. What was mentioned was that there's an encouragement to take leadership roles to protect our Indigenous community, that we're not immune to this. And so it is impacting everyone. So there was an emergency pandemic committee that was created out in Kihiwan. And the efforts of making sure to plan early, planned early on when this had first started. So the decision was to close the community and close the roads to access that community. So those are some of the things that were made in efforts. There are higher rates of racism, and you know, for our Indigenous people, when they're going to the emergency rooms, they do need to be triaged as fairly and equally as everybody else. There's different scenarios on the reserve than what a lot of us are seeing in the urban communities. So there's a need to be proactive and having to plan how the response is going to look. Indigenous people are sovereign nations, and we need to protect our Indigenous people at all costs, because it is very triggering to be closed off and isolated to our communities. So some of the efforts being made is these smaller communities are learning their languages and going back to their traditions and their culture as a way to respond to having to be isolated, which is an amazing opportunity. I think there's a lot of benefits that we need to recognize as well because of what's happening, even though we are responding in fear mode and the unknown. I believe that there's a lot of benefits that are going to be coming out of this. This is not the first pandemic that our Indigenous people have experienced, and I know a lot of our speakers have mentioned that. Smudging is being used as a cleansing, as for our spiritual and for the germs that are in our homes, so they're being used as an antiseptic. The minorities have been affected tremendously, and we need to pay closer attention to those populations. Indigenous people need to get internet and technology access more now than ever, and for the future, because this is not immediate response. We have to also start thinking of recovery phase and resiliency phase, and what that's going to look like. And so those technology and accesses are very important. As mentioned before, you know, this isn't our first pandemic that our Indigenous people have experienced. So there is a fear of community isolation and being sent home and some of the things that we've experienced traditionally. So it is infecting us in different ways. It has been hard on Indigenous people, as it does bring up a lot of our past and a lot of the past history. So it is triggering and can affect us in our mental health and in our well-being. So there is definitely a need to heighten our awareness and what do we have and what are we coming to and working together. And one of the things that was mentioned is when we know better, we do better. I really like that. Starting to listening, we need to start listening to Mother Earth, because this is her way of saying that something is happening and we need to make some serious changes for the future and for the better of our generations. We need to connect back to our traditional ways and in the community. We need to listen to each other and listen to our traditions, protect and feed our spirit. There has been heightened inequalities and experiences to Indigenous people, our land and our policies. So thinking deliberately of how it's impacting our Indigenous people, but it's good that we're thinking already of how it's going to impact our Indigenous people, but recognizing that it will have a significant impact as well. Food security has been a huge issue, and the smaller communities or the Indigenous communities, the drinking water has been a huge issue as well, and accessing the basic needs, whether they are on reserve or in the urban settings, is very challenging. So it's wonderful to see that there are some efforts being made, here in Calgary. There has been some gestures from the government, but there is also just the fear and the inequality that it might have on Indigenous people and accessing or qualifying for some of these supports. There's also a fear of taking back the virus to the communities, and so people are having to stay where they're at and not able to go back to their homelands and to be with their families. So they have to just ride it out to wherever we are. There's definite awareness of environmental impacts and disruption. Indigenous people have to choose sometimes between protesting and keeping themselves safe. So that's definitely an issue. So there's some of the efforts that are being made is creating partnerships to collaborate and mobilize the support. So the Friendship Center, amongst other agencies, have been delivering hampers and helping parents and helping the elders. But there are so many facets to the work, with getting these supports out, especially when it comes to food quality and having certain needs. So that's tremendous that there's 500 hampers that were given out to the community, but these had to be very customized and creative to support the individual's needs of what for example, the food bank might not have been able to provide. It's been essential to turn to the elders to support these partnerships. There is a huge gap, in terms of having all of these announcements for all of these benefits and the money that is coming in to support, but we need the money today and we need the supports today. And that could be things like laptop, internet access, filling out applications, which is very challenging for people that have never had to do this before, or for our elders. So just taking those things into consideration. So working in this new way is working against our traditional ways. So it's been very challenging to have those losses. So we've been forced to have to create on how we work in these traditional ways. For example, we're doing a virtual talking circle that we would normally do in person. So just having to start thinking in these different ways. But it has brought us together to immediately mobilize these efforts, which is a true sense of community. And just to thank all of the efforts that are being done in terms of the committees and for example, the outreach team and people that are really getting the supports directly to our Indigenous people has been phenomenal. So I hope that I was able to kind of capture everything that was shared from all of our tremendous knowledge keepers. I am going to turn it over to James to close, and I don't think we're going to have any time for questions. I'll leave that up to James. But I want to thank all of our speakers for being part of this virtual talking circle. And thank you for sharing your knowledge. And we offer our blessings and our prayers for you all to stay safe and stay healthy. And so with that, I will turn it back to James. Thank you.
Hello, yes. We won't have time for questions actually, because we're just coming up to the top of the hour now. But what we will do is record all the questions that were asked on the chat and in the question box, and we can maybe address those questions next time we meet. So as I said, we're planning for that in about a month's time. We haven't got a date as yet, but we'll take those questions forward. So from me, that was incredibly fascinating and insightful. There are some troubling stories there, but also stories of great creativity and leadership. So thank you to all the Talking Circle guests, and thank you to Daisy. I think you did a great job there moderating and summarizing. Thank you too. If you'd like to continue engaging with us on this or any other subject, you can do so on our Open City platform, the address of which is on the screen right now, or you can also contact us through the Social Impact Lab on Instagram, Facebook, and LinkedIn, as is shown. So just go to the last slide, please. So yes, as I said earlier, next week we're looking at the mental health impacts of the COVID-19 health crisis. So we're doing that in the form of a panel discussion with some of the people who are really on the front line of tackling the mental health issues that are resulting as a result of the crisis. So we're looking forward to that one. But in the meantime, thank you very much for tuning in, and goodbye.